Welcome to this week's episode of Surgeon Interrupted. I'm very excited to have Alan Chien here with me today. He is a pediatrics resident and magician out on the West Coast. And, certainly with a pedigree like that, I immediately thought that this was so fascinating and really like a cool multi-hyphenate for us to hear from and learn more about.
Thank you for the introduction, Francis May. Yeah, it's, I think, intuitive to some people and not intuitive to other people. So thanks for having me on.
That's interesting that you say that. I mean, certainly, I can imagine a little bit. I know that medicine as a profession, it's relatively traditional, sometimes like staunchly so. But what I love, I do feel personally like the tides have been turning in these past few years. If I maybe 10 years ago, someone was telling me about their magic and medicine career, I think that that might have been more of a mind-blowing type of thing. But it's interesting that you allude to, do you feel like people are really shocked by that combo of professions?
Yeah, I think oddly the mood changed as I progressed from an undergraduate who would volunteer with magic, and then when I became a medical student doing magic, and then finally when I became a resident doing magic, the compliments, the encouragements I got at each point sounded a little different. Yeah.
When were people the most supportive or enthusiastic?
Yeah, when I was in undergraduate, I would volunteer at an adult hematology oncology ward. And I didn't know anything about their medical condition, which was probably frustrating in its own part. All I would do is magic tricks every week, like magic rounds. And some of them would have brain fog, some of them would have had like bone marrow transplant. I wouldn't know who was who until I walked in the room and maybe got a sense with regards to like what magic tricks I would choose for them. And at the end, I would tell them, oh, like, or they would ask me, what do you want to be when you grow up? And I would say, well, I'm planning to become like a doctor. And they go, oh my God, you're going to be an amazing doctor. And I had not performed traditionally a single bit of medicine, no?
Mhm.
And yet they were offering me these words that I was like, "Oh my gosh, like this is the career that my skills would be great for." Um, and that was enough to hook, sink, and swim me for medicine at least. But yeah, things changed. Things changed as I got older.
That's funny, yes, and the switch up is real, the switch up happens, like, for the undergraduate, it's like, "Yeah, we applaud that you are three-dimensional and you love this art and you love to create and this and this and this," and that can even help a medical student get to where they need to get to, and it certainly helps make medical school possible. And that's when we start to be like, should you be doing your art or should you be studying? Like, what are your scores like and things like that. And then definitely by residency, there's this very like harsh feeling of if you get pimped in the OR and you get that question wrong and people know that you were painting over the weekend, like best wishes to you because I'm afraid you're in danger.
When I went through my residency interview trail, I had um, a program director interview with. He told me, if you, Alan, have the chance in the future to do a night of reading, like for research to prep for the next day, or you have a chance to go out and perform magic, he said, I want you to perform magic. Because in the long run, that will maybe serve you better, your wellness, whatever you want to call it, in the future. And I think about that. I think about that sometimes. It was sort of a radical thing to tell a resident coming in. And I'm very grateful that someone could say that to me because otherwise I would feel guilty. I would feel guilty all the time about this hobby I've had my entire life.
That's beautiful, and it was such a twist because, yeah, I'm jaded. I was, like, afraid. I was holding my breath for, like, what is this person going to say? But I love that, and it's an awesome example of how strong mentorship can, like, really open up a person's world. I would love to, before we even dive deeper into your life now as resident and magician, you spoke to the fact that this has been a huge part of your life. So when did magic really become first a hobby for you?
I grew up in the Bay Area, south of San Francisco, as an only child. And I think looking back, there was a lot of routine involved from school to extracurriculars, sleep, eat. If I was tired, the answer was sleep, eat, rinse and repeat. And around 9 or 10 years old, I wasn't going out a lot. I didn't have, a lot of friends, neighbors. We weren't that close. So YouTube became my best friend. And I found a couple of channels. They would never show their face, but it would just be a shot of their hands and they would teach card tricks. Um, and I think one thing in the magic community that is obvious is when you're a kid, things that are extremely, extremely hard, you wouldn't know are extremely hard. And so you just go for it. And you're picking up this insane sleight of hand that at my age, I would not even try. I'd be like, nah, it's too hard. That's going to take too much time. But when you're a kid, you just
Mhm.
sort of do it. Uh, and so I ended up picking up a lot of magic at 8 years old, 9 years old, 10 years old. I would do it in class, get in trouble for it sometimes. In high school, I was infamous in the library for performing magic tricks. And I remember there was someone who asked me so badly, like, I really want to see a magic trick. And I was like, okay, but if I show you, you cannot react. You cannot say anything, or I will get kicked out of the library. I have to study. Lo and behold, they in fact did scream, and I did get kicked out. And it was sort of like a walk of shame out of the library. And so I was the magic kid in high school. It was a great way for me to sort of grow outside of my shell. I was offering things people found valuable. Instantly, I think this is a common theme among magicians and magicians who are only children going in. And then in college, I was sort of ready to give it up. I was the only magician in town. I thought I was the beans. Um, but then I went to college in Los Angeles, and I found out there were magicians who did this for money, who made a living doing it. And they had a magic club on campus, and I got my butt kicked. And that just sort of sent me into the magic bug. I caught it again, and I haven't given it up since.
This is just so cool, and I will say I'm a fellow only child, so I can relate to kind of the search for like excitement and also icebreakers. Because absolutely, like magic as a way to put yourself out there and connect with people, especially when you don't know anyone at the function, enormous.
A lot to
So
unpack.
now you're 100% in because you were in LA. And it sounds like a lot of opportunity to hone your craft, a lot of people to connect to. I mean, by being around all of these incredible musicians, did it up your game significantly?
Yeah. Yeah, I think in medicine we get imposter syndrome when we start medical school. And I had imposter syndrome by like 18 years old about being a professional magician because there's this clubhouse called the Magic Castle. You guys have the House of Cards, and I think you're based in Nashville. Is that
Yeah.
where you're at? Yeah, you
Yep.
guys have the House of Cards, and we send some magicians over that way from Los Angeles. Frankie Fodi, he's great over there doing close-up magic. But we had a mentorship program in LA at the Magic Castle in like Hollywood. It's sort of like a mecca for
Whoa.
magic. We had between age 13 to age 20, coming to class every month, all locally based, and half of them ended up going pro and doing like magic for professional living. And so here I was in a space where, I was going to school, and that was sort of the only career that had been put in front of me. And there are all these creative people around me, doing such different things, having such different routines that I was curious. I couldn't help but be curious on what that life was like.
That's so cool. I mean, so you're still in LA. And so
Yeah.
are you like still a part of that community? Are you still in touch with the pros and
I bring out co-residents like once or twice a week to Hollywood, and I'll do shows. If I have a golden weekend, the last couple of days ago, I worked in a speakeasy bar in Hollywood called Black Rabbit Rose. I've done that since 2019, and it's like my second family over there. I brought my girlfriend's family, and they comped tickets. They had a great time to watch the show. It's just one way that I process, my life experiences. More than so a hobby anymore. It's how I process things, yeah.
absolutely. And the way that you speak about it, it's part of the identity. And I definitely, I'm in awe because the the role that it played, like, in your upbringing and your identity formation, and then even who you are now as a resident, this is very, very much something. I envy you because it sounds like a superpower to me. I've talked a little bit about like I was a surgeon and definitely, surgical residency, all these things. If you don't have a rock solid foundation and knowledge of who you are, before 5 years in a surgical residency, again, best wishes because you're going to get rocked, as I did. And so I love it because I feel like it sounds like it gave you a stronger foundation, again, and especially for like only children who sometimes we mill around and it can be harder to like find something to really sink your teeth into. And then now as a resident, it's almost like you have a built-in way to come back to yourself.
I will say I got lucky doing residency in Los Angeles because if I wasn't,
Yeah.
I can't imagine what that would be like. Yeah.
It's so interesting. Is the magician world like what are the other multi-hyphenates, I guess? You even
Yeah.
mentioned when you came up, half of them went into pro, you went into medicine and stayed in magic. But yeah, what's like the distribution like? What's everyone up to?
Just within my um junior society, sort of the people I grew up with,
Yeah.
some of them went to college. They went to very nice colleges and got into computer science,
Mm,
startups, that sort of thing. They had siblings. All of them had siblings who are artists, like musicians that I listen to that I think Obama shouted out like a couple of years ago for his like playlist of the year. He'll do
yeah,
that little
wow.
short series.
Yeah,
And one of my magician friends, Franco, his brother Calimosa, got a shout out, and that was mind blowing. Um,
that's awesome.
yeah. And then when I go visit the clubhouse and there are people who buy membership and hang out, there are people who are like in the top like consulting, businesses, but this is their like side hobby and they sit on the board. Um, Neil Patrick Harris was famously like on our board of trustees. Um, uh, we did some members of like the Mythbusters, Grant Imahara. I saw him. He was there. He loved magic. Um, it
That's
is,
awesome.
yeah, it is weird. It is weird. And I'll see Jimmy O Yang. I've seen Aquafina at the club, and Aquafina has wanted to get into magic. I think she posted on Instagram like 2 months ago. And I saw her like one night there, and I was like, "What is she doing here?"
And
So
I love Jimmy Yang
yeah,
too. That's awesome. I guess that because you shared like all these other kind of like professional pursuits, professional development out of the magician community, what transferable skills do you feel like medicine brought you? I definitely, my ears perked up when you talk about consulting because I can definitely see how some of these magicians are just killing it like as consultants. That's
yeah,
its own
yeah.
whole
Yeah,
game.
yeah. I think at the end of the day, I think the trait that they all share is that they just like problem solving. I think it's a very big club. There are people who like performing, there are people who like inventing, there are people who like watching. But ultimately, I think they are all very curious about how things work. And that we
Mm,
all share in common. That's the love of the game. And for me personally, I think you said it nicely, but it's very grounding for me. It's weirdly so grounding for me to go out on a Friday night for, like, some drunk people to yell at me. Like, it's just feels and I'm on the same team as the bar back, the bartender, the manager on the floor. If there's someone like a troublemaker, someone tough in the crowd, and I'm gonna try to win them over, and if it doesn't work, I'll go back and say, "Did anyone else have a hard time?" And they're like, "Yeah, Alan, we tried to warn you." And it just is so humbling and it's so nice on the flip side to celebrate. People work a long week and that's their Friday night out. Or the other day, like someone was celebrating their wedding anniversary, and I got to be a part of that. And sort of, we miss a lot of friends. I miss a lot of friends' weddings and celebrations, even if I'm in the same city as them. And so it's nice to at least be a part of it. And that relation, being in relation, that is a reminder that how important it is for me to be in relation with the people and magic and connecting with people. And when I go back to the hospital, I think that's the thing I bring back, just an awareness of what it means to be in relation and what it means to connect with people. Magic is my baseline, but going to the hospital, which is so much more intimate, and when I don't get a chance to do that, that's when I know something's gonna go wrong with me. I'm gonna get burned out faster, because that's a rewarding part for me.
yeah, very beautifully said. It's so funny because only children are just built different. When you said that your preferred form of like a Friday night is getting heckled on stage. I love this in relation piece that you're talking about. And exactly, to me, it makes perfect sense that you are also a physician. the person who came from where you're coming from, developed all the skills that you have, and wants to be in relation to others and to connect with the world in this sense, it really does. I see clearly why you would go into medicine. Do you speak much with your patients? I mean, it's great. It makes, again, extra sense that you are in peds.
Yeah, yeah. The most natural way it's fit in so far is if I'm on a 24-hour shift and we have night rounds and I know the patients from the daytime, my night rounds become social rounds, and I just get to do magic for all of we have a hemonc floor, and I'll just
Mhm.
do magic for the hemonc. I'll disappear. I'm infamous for disappearing for an hour or two, just rounding with the kids and hanging out with them. If there's nothing acutely going on, no like codes or rapids being called. And that makes me very happy. It makes the nurses very happy. It makes the patients very happy. I do magic a little bit less now. I'm a year and a half into residency. And in the beginning, it was my way to connect very
Mhm.
quickly, like 30 seconds, to share a very unique experience with them.
Mhm.
And as I've gotten to spend more time with like kids and adolescents, like the angsty ones, I
Mhm.
have a better feeling of how to connect with them without a magic trick.
Mhm.
And I think the important part for me, the reason why I do it is to make them feel like a teen or a kid or to return them back that identity. The minute they enter a hospital, it's numbers, numbers crunching, and I can do something to return that identity back to them. It could be honestly, I wouldn't care what I did. If someone has their own way of doing it, I just think that to me is so important.
Absolutely. That makes a lot of sense. As you look forward, because you're at the halfway point now, I suppose, in a sense. Do you know what you want your career beyond to look like? Will there be medicine and magic interwoven, and how do you see that playing out?
Yeah. I think residency has very much been like a survival mode. And so I don't think honestly I could make any accurate predictions what I would like life to be like after I finish. I could barely like cook and clean and have a good meal for myself, which and sleep, which I've realized are the fundamental things that I need. And then after that, maybe play basketball, something like that. I honestly don't know. I don't know, but I do know that my love for medicine has to do with the relationships I make with my patients, and that is something that I'm investing in heavily, hoping that, I think you've talked about gut instinct on this series too, that will.
Absolutely. I love it too because, again, going back to this in relation idea, this is why I think that all the things that you've been drawn to and what you have professionally invested in, maybe somebody so superficially in passing, they would look at magic and they'd look at medicine and they'd dismiss it. They'd be like, wow, crazy, diametrically opposed. Whereas even this thoughtful treatment of it and you explaining your experience with both, there's a lot of alignment there. I'm very excited to see, and I encourage you to, just carve out your own way because obviously you're not going to be able to look at the litany of so many successful magician doctors. Like, and so I think that it is a blessing and a curse to not have that. There's a lot of beauty in the fact that you are going into uncharted waters.
Yeah, yeah, I agree with you. And right now I'm collecting my value belief system about how I'd like to practice medicine. And so I'm glad I'm getting as much input as I can from great clinical experiences and then sacrificing a little bit of sleep, but surrounding myself with, creative people, regular people, outside of medicine people. Yeah.
Yeah, I think that always helped me a lot. The more that I spent time with people who weren't in the hospital, like that's how we get very myopic, very limited in our mindsets because you just totally lose perspective. And so it took for me talking to people outside the hospital, ingesting, art and philosophies and things like that from outside the hospital to get me out of that headspace.
Ironically, I became very good about being in relation with my patients. And then I'm on Christmas break, I have a week off. There are moments where I realize I'm so bad at being in relation with my family, with my girlfriend, with my hobbies, with basketball, with, everything there is good and there is bad. And this is something that fundamentally changed about wellness for me. I think coming in and they sometimes would put me as sort of spokesperson of wellness because, I do magic and I'm balancing this career. But the ability to tolerate, and this is my therapist, Kim, I have to shout her out on this one, but the ability to tolerate the highs and the lows are what make me extra well. It's not when things are going perfectly. That isn't when I would describe me being like the most well I've ever been. It's when I can tolerate like working in a system that has a different value system as me, but I can still enjoy, the patient interactions and maybe sometimes the not so great patient actions as a result of the system. Um, I can recognize all of those things and still enjoy and feel all of those things. That's when I am the most alive and I am the most well.
We are 100% on the same journey, Alan. I think of my therapist said to me when I was a chief resident, you need to learn to relate to your values differently so that when they are not reflected in the world, it does not cause an existential crisis. I know, exactly. And then the mic drop. Like, I was like, oh, he read me to filth that day. And I remember exactly when he said it to me. But I do think a lot of the resident experience, somewhat ubiquitously, like, is imbued with that idea. Like, the systems we're working in are not perfect, so it's very hard to feel like complete alignment with the value system of the beast that you're working in. But I do think riding the highs and the lows, appreciating the highs and the lows, that's part of the key, I think.
I don't know if it came up for you, but for me, like getting mirrored as a child, that wasn't really a thing. And so I'm very sensitive about being mirrored, and I, for the longest time, thought that if I wasn't mirrored, something was terribly wrong, that I had done something terribly wrong. But just some love for all the only children that, um, maybe it's not that deep sometimes.
Yeah, shout out to only children. Exactly. No, it's very hard. I liked being an only child in some ways, but exactly, like, have to figure out the world and our place in it in a little bit different of a way. The other thing that I want to mention, because I think that this helped unlock a concept for me, which is that when you describe riding the highs and the lows, I think of the Pema Chodron How to Meditate book, which she opens with essentially she is just devastated. Something awful happens at work, right? Something devastating, runs to her mentor, and she's like, this thing happened. I'm inconsolable. I'm crying. I'm upset. And they said, so what? They looked at her and they said, so what? And she was kind of like, wow, that really, that was great. And I was like, you know what? You're right. And so what? And we kind of like process, integrate, move on from that. A little while later, she lands something amazing at work, right? I think it's literally like this book deal. Like, so huge news, amazing news, same thing, sprints to the mentor and is like, you won't believe this. We landed a huge book deal. Met with the same response. So what? And I do think for me, that's played out very interestingly because I'm trying to incorporate that in my life. And how that looks is just that for sure, it's very helpful because when I'm in the lows, it's kind of like, this is temporary and just so what? But it's tough because it also means if you want to truly like live on that middle path, that then even when like the best news ever happens, yeah, part of me is going to be rallying and celebrating a little bit, but then part of me tempers it and kind of will give the so what. And it's because that's kind of the price to pay to not let the lows be devastating. It's like a toll.
Yeah. That's so exciting and scary to have a new life perspective. And I wonder what it would sound like. I think one thing I didn't realize going into pediatrics is that I would have to heal myself in the process of, a parent bringing in a newborn, a 2-year-old. They're very frustrated. They're crying all night. You don't how what I was taught, what I was modeled for me, how to parent may not work for you. And to realize that and to take a step back and to be like, okay, what values, how do you want to deal with this? How do you deal with anger? How do you deal with frustration? The parents, I'm working with the parents and I wonder if I give them the so what.
Well,
Start them early.
when the student is ready, the teacher appears.
Yeah.
I wouldn't say that stuff to just patients apropos of nothing, but no, it's funny. And the reparenting that like we have to do as physicians, very, very significant. So I love that. I love it. I guess so. Before we wrap up, I would love to hear a little bit about maybe some more advanced magic, and if you wouldn't mind, like sharing with us, maybe what's one trick that you are so proud of from residency.
Yeah. when I came into residency, I started taking my co-residents to the Magic Castle. It'd be like 5 to 20 of them at a time, and it was a legit like experience. And I would take them to my favorite shows, and then I would take them downstairs to sort of an improv room, and I would do a 20-minute set. And I have some of the 20-minute sets filmed. For sort of our practice, we're allowed to do that. It's like sort of the only camera taking we could do.
Oh, yep.
And it's they are so supportive of me, but I'm kind of like, we are our worst critic. But I would say that it wasn't the best thing I've ever done. And so I made um this sort of ritual my practice. And so I started working on a show. And for the last year and a half now, I've been working on this show. I call it The Lemon Tree. And it's about me growing up as an only child with a lemon tree in my backyard and my parents jokingly calling this tree Brother Tree. Um, yeah, sort of giving an inanimate object life. It's sort of my experience finding order from disorder. Things go awry in the show. I have this very like humble, quiet. I'm a quiet person outside until the show. I sort of turn it up, and it sort of all gets everyone invested for the final bit. I can't tell you the ending because that's sort of my ace in my pocket. But I basically set them up the whole show for the ending, and I had the idea for the Lemon Tree a year and a half ago, and I worked with the magic community is very supportive, and there's this guy David Williamson, and he's toured with the Illusionists, which is like that group of 5 or 6 magicians, and they're
Mhm.
on Broadway, and he's done his off-Broadway shows. He's done a circus show, and he's helped so much in sort of directing, helping me. We'll go through every second of the video. He'll be like, "Why are you petting the table like that?" And I was like, "I'm anxious." Okay. He's like, "I've never seen that. Magicians do weird things when they're anxious, but I've never seen anyone pet a table as much as you have." So it's just moments like that. He'll just walk through painstakingly each line. Why did you say that? Until I have like something I'm very proud of. That is me. That can get people into my life and to connect with me in a 20-minute, show. Yeah.
Obsessed. So when is this show going to be live? Like, how can people watch it?
Yeah, right now it only exists in the basement of the Magic Castle, random days of the week. I don't know. Maybe in the future I would want to take it and like do a little festival with it. Maybe get a little black box and maybe a little residency for a week, and then we'll see. We'll see. It's a fun show. I get a nickname during the show. Um, yeah, that's part of it.
I love it.
I share. I say one of my dreams has been to have my name chanted, and then I'll have 6 names, and they'll pick one, and it's a yeah, an only child. It's an only child dream.
That is the only child dream. You've cracked the code.
Yeah.
I'm very interested. I'm happy for you. This has been so fun. I loved cutting up with you and you sharing like a little corner of your super unique world with all of us. Thanks for being here.
Thank you, Francis. I'm excited to see who else is going to be part of this conversation, this very long conversation you're having. All the guests, the comedians, the med students, the residents, the attendings. It's so cool to see all of this in one space.
Thank you. And I love the way that you put that as like one very long conversation because, certainly as a fellow only child, like absolutely kind of looking for through lines and patterns and ways to connect, maybe where they didn't previously exist. Thank you so much for tuning in to this week's episode of Surgeon Interrupted. If you enjoyed the episode, please subscribe, rate, and leave us a review. For more shows and content like this, check out Hippocratic-Collective